Hi, everyone. My name is Naomi Allen. I'm the co-founder and chief executive officer of Brightline, and I'm here with my colleague, David Grodberg. David, do you want to introduce yourself?
Yeah, hi, I'm David Grodberg. I'm a child and adolescent psychiatrist and adult psychiatrist, and I'm the chief medical officer of Emilio Health.
And we are excited to talk to you today about Brightline, which, as David just mentioned, is formerly known as Emilio Health. So you'll hear us accidentally interchange those names a little bit back and forth, and that's because we've just recently made the announcement that we are renaming the company from Emilio Health to Brightline, which we're super excited. It just really reflects a lot of great consumer feedback we've gotten. And the concept behind Brightline is creating a line of sight to a really bright new future in the pediatric behavioral health space, and really a very supportive and family and child focused name. So we're really excited about that. Today we're talking about going from surviving to thriving. And just want to say a big shout out to Salome. Thank you so much for putting on this virtual conference at a time that's so important. And we're really talking today about reinventing the family-centered care model in the behavioral health space, and how can we help families move from really what's been a very fraught few months here to really thriving in a new environment of family-centered care for themselves and for their kids. So just broadly speaking, I think most folks are aware of these statistics, but obviously we're in an urgent crisis, not just in behavioral health, but in pediatric behavioral health. And so for those of you who are familiar with the adult behavioral health space, think about everything that we're seeing in the pediatric space just being actually more difficult. Children's behavioral health care is really at a crisis point. 1 in 5 kids have a diagnosed behavioral health condition. Many clinicians believe about another 20% of the population has an undiagnosed condition that would receive a diagnosis if only there was enough access to care. Of those kids with a diagnosis, only 20% of those children are actually receiving any treatment in any form. And so what we see happening is as kids get older, we're just having greater acuity of behavioral health needs, crisis leading to acute psychiatric and severe mental illness. Despite the Mental Health Parity Act being in place since 1996, which is the year I went into healthcare, we see that actually in the pediatric space, year over year, more families are having to go out of network in order to receive care. And so this is just also creating an affordability crisis for most families. What we're seeing is also, and David will talk about this, medications are increasingly the only treatment pathway for many families. And that's because so much of the care delivery has been shifted into a primary care setting. So families are also not receiving any form of really integrated care for their kids, thinking about medication management in conjunction with behavioral therapy. And then, not surprisingly, healthcare expenditures are large and growing in the pediatric space. And what's often not really understood is that there's comorbidities between families. So for families that have a child with a pediatric behavioral health need, the parents themselves are often 40% greater to have a risk of depression themselves. Therefore, expenditures are much higher, not just for the kids that have behavioral health needs, but for the family unit overall. What I'll say is that not unlike other areas, we're seeing an overall, sort of increase in the challenges with COVID. So what we know is happening across the country is that there's an even greater wave of need coming in response to COVID-19. And I'll hand it to my colleague David to just talk about from a clinical perspective what's happening in other countries and what is predicted to happen here.
Yeah, I mean, across the world, parents are reporting significant levels of stress among children, specifically in the form of anxiety, depressed mood, difficulties with being organized, sleep disturbance, appetite, no one's exercising. So really across the board, there's a really high level of difficulty being reported.
Yeah, and so, just statistically what's playing out is, a third of kids are dealing with loneliness, nervousness, 50% of kids worrying and struggling with boredom and isolation. And I think probably the most worrisome statistic here is kind of the response is that an increase in prescriptions being written, but also a marked increase in first-time prescriptions. So I think the challenges were in very early days of COVID-19 impact and really understanding the impact, but we already see from the data that's coming out, from the headlines that are hitting the news, that there's a really big wave of need that's coming on top of the challenges we've already had. I think for better, for worse, this is now becoming front page news. This is just a few of the many headlines that have come out in the past month talking about what we should all expect, which is that being under lockdown, parents having increased stress and anxiety, job loss, economic fragility, all of those things are causing a real wave of need for kids. And by the way, we're returning to work at some point, right? And so what does that mean? That means that as families think about work reentry, one of the things that's top of mind for parents is, what does this mean for my child? How are they going to reenter school? What type of care, psychologically is my child going to need to be successful after this period of time of being in lockdown? So, I think we're going to see an even more exacerbated need in the next months. So who we are, we're really thrilled to get a chance to talk today because we are really reinventing the entire care delivery model in the pediatric behavioral health space. And we talk about creating uncommon support for common family challenges. For the parents, the aunts, the uncles listening to this, either you or a very near neighbor, near loved one has probably had a child in your life with anxiety, with depression, with ADHD, with disruptive behaviors, with social communication skills challenges, with motor coordination and sensory challenges. And so these are common family challenges that really get to the heart of all kids. And we're reinventing the care delivery system. We'll talk about how we're doing that, but essentially think of us as a hybrid model, brick and mortar clinics with a robust technology platform that supports telehealth for kids and a complete set of programs that support parents and caregivers as well. And so we're really excited to have a creative approach to solving what are very common challenges. Just on a personal note, I'm a mom of 3 kids. One of my children has had a pretty extensive journey through the behavioral health system. And I just saw firsthand how incredibly hard we make it for families to have a really great care experience. And so David and myself, my co-founder Giovanni, our whole team is really dedicated to reinventing the model to make it great for families. So speaking of our team, I'm really proud of our team that we've assembled. We're very fortunate to be funded by Oak. So Annie Lamont and Billy Dyke and the team there are seed investors. Think about our team as really bringing together a set of skills, very deep healthcare, entrepreneurship expertise. This is my 3rd company, an early stage company. Prior to this, I was the chief growth officer at Livongo and a founder at Castlight. David is a very experienced clinician in the child and adolescent psychiatry space, both as a clinician as well as a well-regarded researcher. Giovanni, my co-founder, is a psychiatrist by background, but also a serial entrepreneur. And then Jonathan Simon is our chief technology officer and really brings a tremendous wealth of experience at the intersection of consumer technology as well as regulated industries. So what are we doing? We are starting in our MVP launch this fall with supporting kids aged 3 through 12 with a plan to move into adolescent and teens next year. And we're really supporting children in terms of the care delivery, but also creating a whole scaffolding for families. So I'll talk about that in just a moment, across a broad set of clinical conditions. So think about us as essentially the most prevalent and greatest areas of need, and pulling together support across disciplines, across clinical domains, to support things like ADHD, anxiety, disruptive behaviors, as well as providing OT and speech language pathology treatment. And so one of the things we've heard time and again from families is just how fragmented the care delivery is. And so we're bringing together all these domains under one physical roof within our clinics, as well as under one technology platform from a telehealth and an app perspective. Our go-to-market is hybrid, so we're starting with a cash pay model, but we're very actively working through in-network relationships with some of the largest strategic regional blues, as well as national carriers, because we believe that access is really important as well as affordability. So really excited with the progress we're making there, and planning to price the product as a fee-for-service plus subscription model. So I'll spend just a minute on our model at a high level. There are really 5 pillars. So one team, one plan. I alluded to this, but one of the things that's most, I would say, revolutionary about what we're doing is we are hiring clinicians within psychiatry and medication management, psychology and behavioral treatment, occupational therapy, and speech. And they're working collaboratively. And so, the way that medicine's delivered today in this space is so often parents just go to the first clinician that they can get off the wait list. And so sometimes they're starting with psychiatry, even if their child could really benefit from behavior therapy first, or they're going to an occupational therapist for a kid with sensory processing challenges, and they wait 6 to 8 months to get a behavioral therapist engaged for the child's anxiety. And because of comorbidity, it's really important that we are creating one team working off of one clinical set of technology, creating a unified care plan for families. So really important innovation there. Child-centered and family-focused. David will talk about this, but what we know is that there are real ways that we can engage families that have not just higher satisfaction rates for families, but have clinical impact. So we are focused on treatment to kids, but engaging families with a whole set of tools that allow us to partner with families to involve them in the care delivery and the care plan. So really important innovation here. A bright experience where you are. We're very proud that we were able to hire the team that designed the One Medical clinics. And we've hired a really fantastic consumer agency to build our brand. And so the intent is to create a place that kids grow up in, that they feel comfortable going into, that feels positive and engaging and uplifting, rather than a traditional clinic or therapy practice that can feel overwhelming and intimidating. So really excited about creating a bright consumer experience across the board, whether that's in person in our clinics or through our tech stack. Extraordinary technology. Our tech platform is designed to do 3 things. One is engage families in a really elegant and compelling solution to make care easier for them. The second is delivering telehealth seamlessly. So the same clinicians you can see in our clinics are available to families through telehealth. And the third is really reducing all of the hassle factor and the friction around things like scheduling and appointments and billing. So creating a really unified administrative experience for families, rather than the standard of care today, which is 20 callbacks and sitting on wait lists for a long time. And then last but certainly not least, we're using evidence-based personalized care. So within our clinical domain, supporting ADHD, anxiety, et cetera, we're using evidence-based care, and we're tracking clinical quality at every step of the way, and sharing that data back with families so they know what's the treatment plan, how long can I expect treatment to last, what's the quality of care that's getting delivered, and how is my child progressing towards treatment goals. It's a really new way of measuring care delivery, but also sharing that information back with families so they can really be engaged and involved in understanding their child's treatment plan. I'll turn it over to my colleague David here to talk about kind of what this means to support the entire family and why that's such a big difference. And this is, I think, really at the heart of the title of this presentation, which is going from surviving to thriving, because it takes an entirely new approach to think about how to help families thrive in these dire circumstances.
Thanks, Naomi. So I think I'll start by pointing out that a child's behavioral health impacts the entire family. So we know that the direct costs of child behavioral health conditions are soaring. And for example, children with pediatric anxiety have average direct costs of $5,800. But the indirects, that is the impact on families, is vast. And that takes the form of productivity loss in parents, absenteeism, income loss. The other indirect cost that we're so concerned about is the effect of stress on parents. And parents tend to have more stress-related conditions, more incidents of depression and anxiety, and they themselves will tend to use their own health benefits more. As you can see in the slide, 50% more parents of kids with anxiety have depression. So the good news is that we know what works. Digital interventions and telehealth already have a significant track record. Behavior therapy, behavior training, medication management can all be implemented over telehealth quite effectively. And digital interventions themselves are especially useful for training parents. And I've spent the last many years at Yale working with faculty to refine that delivery of parent training, where you train parents to do the same skills and strategies that are used by experts. And it's something that's acceptable and feasible and even effective. We also know that treatment sequencing matters. We have the ability to give families access to behavior interventions either before or during medication treatment. And when you do that, you're not only following the treatment guidelines of the American Academy of Pediatrics, but we also know that that improves outcomes and even makes changes in service utilization down the road. The other thing we know is that comorbidity in pediatric mental health is the rule. And our multidisciplinary teams who round together and share the same electronic health record are poised to identify barriers to care and to act on them in real time. And finally, we know that blended care, that is, when you have a human touch that's enhancing technology, that combination is more effective than when you have simply a self-guided digital tool. So that's why we're so excited to be able to blend our coaching support and clinician support and supplement it with technology. So if we were able to enlist every pediatric behavioral health specialist in the world, it still wouldn't meet the great demand, and especially not now as we're in the middle of a public health crisis. Our company's designed our clinical services to meet large populations, and immediately after registering and filling out a validated screening tool, a parent gets access to both coaching support and parent training content. And as they're waiting for their appointment that they can use our in-app scheduling tool, they can engage in pre-visit preparation. Our parent training also is there in individual and group formats to support the child-focused therapy, that is to train parents in skills and strategies to support the child's treatment. And that would be in between the sessions. We also, because there are different pathways and multi-disciplines at work, there's many opportunities to involve families along the way in shared decision-making, especially when family preference or family-centered goals are critical. Our digital interventions, our telehealth capacity allows us to be truly family-centered and to meet families wherever and whenever they need our help. And the coaches are trained to supplement all of the work that's being done in our child-focused appointments. I think we can move on. And Naomi, I'll hand it back to you.
Great, thanks, David. So this is just a brief glimpse of the technology that we're building. And remember, as David mentioned, that this is in addition to the care delivery. And the care delivery happens either in one of our brick and mortar clinics or through telehealth. So this is a technology platform that's family facing, that they can use with children, that really engages families when they're not in that treatment session. And the idea is these things work as a systems, right? So that the technology can be used to ask questions with a coach, to schedule appointments, to check medications, to track where the child is in the care plan. And then as a child is receiving treatment using our evidence-based protocols, at every step in that protocol, there is something that the families can practice outside of that session with the child in order to hit treatment goals and make clinical gains even faster. So this is just a couple of examples. It's a prototype. We're launching in I think T-minus 7 weeks now. So we're still in the early stages of kind of putting the polish on this, but I'll just give you a sense of what's coming. And you'll see here on the left where it talks about exercises. These are interactive and they're guided by a coach and intended to map to the treatment. So let's just pick on my own son who has anxiety. The body map exercise is really useful for him so he can start to monitor where his own symptoms of anxiety are that are happening. Double bubble is all about reframing thinking, reframing cognition in order to move from really dire thinking to more positive thinking. And so these are all interactive exercises that can be done either the parent or caregiver and the child together, or in some cases, we're just giving instructions directly to the parents so that they can be a partner in the journey. In this case, the child has an appointment coming up with David or their psychiatrist and their care team. And when they come back, they can see the previous exercises, previous appointments. And then also what you don't see here, but it's really important, is we are doing a lot of data visualization to show families and children where they are in terms of treatment goals, how they're attaining their individualized goals as well. So where they are in terms of an overall treatment plan. At any time, the care team is at the ready and can be messaged through kind of that front door person, the coach, which is the liaison to every family. Every family has a coach assigned that's available to them. And can interact with them to answer questions about care coordination, about the treatment plan the child's on, and as well as answer administrative questions. And then that coach proactively will push out the exercises and the things that families need to be doing. So really robust platform. What you don't see here is we are integrating telehealth and e-prescribing as well. And so maybe I'll just preview the next slide, which is we're very excited. This is our first public announcement, really, but that we are launching a telehealth solution. So in addition to our brick and mortar clinics that we're launching in the fall, we're pulling a telehealth launch into the summer. So really proud of that. And it's not just that we're having our clinicians available through telehealth interfaces, but we're launching that in conjunction with our digital platform, our interventions, our licensed clinical staff working off a shared clinical record, as well as our interventions that map to our protocols and online access as well. So really excited to be here. Again, thank you, Salome, for having us and for hosting this incredible event, and look forward to questions in the Q&A. Thank you so much.